Hello, my name is Dr. Krishnan Sundararajan. I am a cardiologist with Advanced Cardiovascular Consultants in Chardon, Ohio. Today I'm going to be speaking to you about the coronary calcium score. The coronary calcium score is an accurate, non-invasive way of establishing the diagnosis of coronary heart disease. Calcium builds up in the wall of the heart blood vessels over a lifetime and can be measured with a CT scan of the heart blood vessels. The CT scan does not use radioactive substances or dye. Once the scan is completed, we get a score which estimates the amount of plaque that's built up in the vessels. The calcium score measures the amount of hard calcified plaque in the vessels. Initially, when plaque builds up, it is soft plaque. Over time, the body converts it into harder, fibrous plaque, and the end result of the whole process of hardening of the arteries is the buildup of calcium and the conversion of hard plaque to calcium. The calcium itself does not cause a heart attack, but it gives an estimate of the total amount of soft plaque that is there in the blood vessels that can then give rise to a heart attack. Heart attacks happen by plaque rupture, where the plaque in the wall ruptures and it is exposed to the bloodstream. A clot then forms at the site of plaque rupture, and this is what causes an acute coronary syndrome. The score can be classified into different levels. If your score is 0, it means that you have a very low risk of a cardiac event. It does not mean a 0 risk, because some patients with a 0 score can still have soft plaque that narrows the arteries and causes blockage or a heart attack. But as your score rises, your risk of a heart attack increases. If your score is greater than 100, then the risk of a heart attack is double the risk when it is 0. When the score is greater than 400, the risk increases to more than 3 times the risk at a score of 0. If you have a positive calcium score, you should contact your doctor immediately, and they will give you advice on various things that you can modify to reduce the risk of a heart attack. The things that they can do is to start you on aspirin, cholesterol medicines such as a statin to get your LDL or bad cholesterol as low as possible, control your blood pressure, and help you to quit smoking on a permanent basis. A regular exercise program will also lower your cardiovascular risk. It is important to remember that calcium that is there in supplements and calcium that is there in food does not increase the amount of calcium that builds up in the wall of the blood vessels. If you want to know your future risk of a cardiac event, it is very beneficial to your doctor to obtain a calcium score. The calcium score, again, by itself does not mean that you need a heart catheterization or an angioplasty or a bypass operation. What it means is that you need to identify your risk factors and treat your risk factors, and also, if it is high, go and see a cardiologist. A cardiologist will perform a stress test, and this will determine if the amount of hard and soft plaque and calcium is obstructing your arteries and blocking the flow to your heart, and therefore needing cardiac catheterization to identify a blockage and clear it. If you have any questions regarding the calcium score, please contact our office in Chardon, Advanced Cardiovascular Consultants. Our phone number is 440-285-2300. If you have enjoyed this video, please subscribe to this channel for future good information regarding cardiovascular disease.